So welcome to the meeting this evening or this afternoon. It's evening for me. I'm in Melbourne, Australia, and my name's Eugenie Kayak. I'm an anaesthetist and also enterprise professor in sustainable healthcare at the University of Melbourne. But I'm here this evening, and it's an absolute pleasure to be here as a representative of Doctors for the Environment Australia, or DEA as we call it. DEA is the representative on ATACH of the health profession associations globally. So we're here this evening or this afternoon to talk about health professional associations and their involvement in ATACH. ATACH being WHO sponsored or supported by the WHO Secretariat, and we've got several members from them as well here this today who will be talking with us. ATACH being a network or an organisation that looks to build climate resilient and low carbon sustainable health systems, whilst also addressing supply chains and nutrition and funding when it comes to climate change, resilience, and sustainability. So, next slide, please. The objectives of today's session, which will run for just under 60 minutes, is to really look at the importance of health professional associations in the membership of ATACH, what we can do as health professional associations to support ATACH, and how ATACH can support our work, our clinical work, really highlight the need to bridge the gap between health professionals and policy implementation and development. We'll also look at and share with you some of the updates that we have undertaken already as a representative of health professional associations and identify some of the engagement opportunities for health professional associations in the ATACH network. Next slide, please. Quick overview here of our agenda. So welcome again, everyone. I've already introduced myself, and when you put your hand up, if you could just please tell us your name and what organisation you represent, that would be fabulous. Next slide, please. So first of all, we're fortunate to have Elena from ATACH, who's just going to give us a brief overview of ATACH, its governance structure, and the importance of health professional associations as a constituency. Thank you, Elena.
Thank you very much, Eugenie. I will not go into too many details, but I just wanted to present a little bit how the Alliance for Transformative Action on Climate and Health is organized and the importance of constituencies to drive the strategy and priorities forward. So basically, I am Elena Villalobos-Prats. I lead the secretariat of the ATACH. And what you see in the screen is basically a high-level summary of how the ATACH is structured. So as you can see, we have a governance mechanism and an operational mechanism. And in the governance mechanism, the most important actor, I would say, is countries, because basically the ATACH and WHO is mandated to understand which are the country needs and priorities to be able to move to action at country level. That's why they committed to increase action. And basically, we need to understand where they are and what they need to be able to move. And then we also have the co-conveners, basically WHO and the UK as founding members of the ATACH, but also the different presidencies to the COP. So far, we have Brazil, and Turkey has also accepted to be the co-convener. We are waiting for a response from Australia, but hopefully they will also agree to serve as co-conveners during their mandate. And during the history of the ATACH, we've had all of the COP presidencies serving as co-conveners. And then we have the steering group. So the steering group is a body represented again by different constituencies that basically look at the mandate of the ATACH, priorities, strategy, and tell us whether or not what we are doing is the best thing for us to do to get to our outcome. So basically, strategic advice is directions on the best mechanisms to deliver our goals, the best mechanisms to respond to country needs. And these constituencies, basically, we have many. Health professional associations is one of those. Um, and throughout different discussions that we have with Doctors for the Environment Australia and with different partners, we recognize that there's a huge potential in this constituency to really drive action at country level. So basically, there are many things that are happening already at country level, also within specific health professional associations. And we are not talking only about doctors or nurses. We are really talking about the whole range of health professional associations at all levels. Could be international federation, could be national, could be regional. But basically, we thought that if we manage to convene all this constituency in a manner that we can promote what is already happening and also get to a level of potential engagement and prioritization but by the constituency telling us, okay, within my own constituency, we think we can promote either something related to greening or something related to adaptation. Again, it will be different depending on the constituency, to basically drive action at country level. We think that, let's say, emergency doctors find it easy to either decarbonize the way they deliver care or build climate resilience by either advocating to their peers or bringing together using weather information to, for example, understand when there is going to be a peak in visits due to heat stress, you name it. But basically, this is what we thought, and this is the purpose of this meeting, really, to talk with all of you to understand how this could be done. And just to reflect a little bit on what has been discussed this morning, there were some members of the constituency that were interested to know whether there was an opportunity by these health professional associations to be part of the global movement and set the agenda. And there is, because basically just by sitting in this steering group, you will have the opportunity to drive the priorities, to contribute to the way we drive priorities together. And of course, is the other way around too. We are looking at you also as real agents of impact at country level and all levels. So this is everything from my side, Eugenie. Thank you.
Great. Thank you very much, Elena. Next slide, please. So Doctors for Environment Australia is the representative of health professional associations globally on the ATACH steering group, and this occurred through an application process that we applied for last year, and we're absolutely delighted to be the representative on the steering group. It's really important to us that we are a diverse voice, aiming to represent not only medical professionals, because we as an organisation are a medical voice in Australia, but also nurses and allied health and a very diverse group of health professionals across the globe, and particularly in the global south as well as the global north. Doctors for Environment Australia, is a little bit of background. We've just celebrated our 25th birthday. We're an NGO, a charity in Australia, and we work with communities and health professionals to respond to the health effects of climate change, but also to mitigate and prevent climate change's impact on health. Our vision is healthy planet, healthy people, and our purpose or mission is to protect health through care of the environment. And we do that in many ways through education, advocacy, policy influence, legal challenges, and much, much more. Next slide, please. So since our appointment on the ATACH steering group, we have gone through a consultation process and an engagement process. And we're always looking for more input when it comes to guiding how we should represent health professional associations with ATACH, as Alina suggested. We've undertaken two workshops with national and international HPAs, including those in medicine, nursing, allied health, and public health, with representatives from both the global south and north. Done an online survey of our own members to inform priorities and work plans. But as mentioned, our priorities are very much there to be influenced by members of the HPA constituency and can be influenced, changed as we move forward. We've drafted an article on the ATACH website to promote the constituency and encourage others to join, and written to, I think, well over 100 organisations to encourage them to join ATACH and to be part of this constituency to make it as strong and influential and diverse as possible. And that's part of our extensive outreach when it comes to emails, and also talking at academic conferences and other conferences, representing ATACH and health professional associations at COP30, and looking also for towards the future COP events. Next slide, please. In all this consultation process, at the moment, the priorities and activities that we've come up with are, we've got three main priorities presently that we're working towards, and that's to build a trusted and effective global network of HPAs to be represented on the ATACH steering group, but also to help facilitate ATACH's strategy and goals and objectives when it comes to the clinical workplace that many of us are involved in. We're looking at strengthening the position that the HPA constituency has with ATACH's strategic global work, and making visible or more visible the climate risks on the healthcare workforce, the healthcare systems, and the contribution of the global healthcare workforce when it comes to climate action, and also promoting and encouraging sustainable healthcare going forward. We've talked a little bit about our activities around outreach and engagement. We've been attending steering group meetings in an advisory role, authored several articles, and as I mentioned, involvement in COP30 and then COP31. We're in the process of developing a position statement aligned with the ATACH strategic plan, and this will be a Health Professional Association position statement. It's very much in the draft formation at the moment, and we're really looking for health professional associations around the globe to join this constituency and actually help us to develop that position statement further, and with the eye of actually presenting it at COP31 coming up towards the end of the year. Next slide, please. So we've got quite a lot of time today, or not, well, maybe quite a lot of time, half an hour to 40 minutes for really to open up to the discussion. And it's good to see a diverse group of people here today to get your ideas, because this is a consultation process, what you feel the role of HBAs are when it comes to ATACH, and what the role could be, how we could strengthen our role. One in advising ATACH, but also going the other way with ATACH helping HBAs with their work. Priorities for the constituency, how we can work to build the network to make it diverse as possible, and what might be the best ways of working together moving forward. So please, if you can, turn on your cameras and feel free to ask questions or comment. And I'd be very interested, I guess, to hear what your thoughts are about the role of HPAs when it comes to ATACH. I know myself, I have very strong views on this. I think it's absolutely important that we have clinicians, health professionals involved in some of the policies that are made when it comes to the health system, when it comes to climate resilient and sustainable low carbon health system. It's a really important voice. We have a lot to bring. We're at the practical coalface, if you like to say that, when it comes to providing healthcare. And we also see firsthand the impacts of climate change and environmental degradation on our capacity to provide healthcare for our communities and populations. So I'd be very keen to hear ideas or even questions. If people have questions that you would either like to pose to myself or Alina, that would be very helpful to get the conversation started. Hello, Maya.
Hi, Eugenie. It's good to see you.
Nice to see you.
So officially, to follow the rules, my name is Maya Van Bruggen. I'm the program lead for the Geneva Sustainability Centre and also worked with the team because I'm Australian also. I just wanted to check. I wonder if it's helpful to put those dot points in the chat so we can still continue the conversation while we look at each other, but just reference the dot points for the discussion in the chat. If someone is managing that, I think that would be super helpful. Thanks, Eugenie.
Okay.
And just
you.
in support of what you said, all of those elements, the work that you've been doing has been spectacular, and looking forward to contributing to the position statement.
Okay, that would be great. We're very much are looking for contributions and everyone's ideas and input. There is just so much knowledge and expertise in health professional associations and health professionals that it can't go untapped. Thank you. Sarah. Thank you.
Hi, lovely to meet everyone. My name is Sarah Loudon, and I work for the Canadian Medical Association. I lead our climate and health portfolio, which includes our work on decarbonizing the health system as well as planetary health. I just wanted to start by saying thank you for convening us all. It's really great to see everyone here. We joined ATACH about 2 years ago, and it has been a bit of a process to sort of understand how, as a medical association, we can contribute in a meaningful way. So I think it's great that everybody's here. Just a couple of points to the questions that you were asking, Eugenie. For us, I think the importance of having the health professional associations at the voice is when is really, like you said, we see firsthand the impacts on patients and the population. And so really to be able to bring that trusted voice that we know is still amongst the most trusted voices out there. I was interested to know what the position statement, just, and I apologize, I was a few minutes late joining just because of the timing on a Monday morning. But yeah, curious to know if within the position statement there's anything that we could be doing to support. We will have a survey going out to our members later this year. We're looking at collecting some baseline data on some planetary health stats. So if there is anything you're looking to be able to get information on, I'd be happy to take this offline and see how we can support. So.
Okay. No, thank you very much for that offer and for your feedback, Sarah, and we'll definitely reach out. I've mentioned the position statement, and as I said, it's in the draft. It's first draft. It's very much will be circulated with the health professional associations that are part of ATACH, and then also I expect more broadly as well to get as much feedback as we can.
Wonderful. Seeing it.
And it's good to hear, and you emphasize again the importance of the role of health professionals when it I mean, we are in the business of health and healthcare, and our voice when it comes to policy and influence, and also when it comes to clinical care. And I always also say that we won't actually have changes in clinical care, sustainable changes in clinical care, unless we bring health professionals along with us on this journey. So it does go both ways for sure. Great. I wonder if there are any other questions or comments, and anything at all, we'd be very happy to hear. I think we might have sort of re-emphasized that health professionals do have a role. And I wonder if there are people in the meeting tonight or today, this morning for you, who may have ideas of what the priorities of the Health Professional Association should be in representing the constituent. And also we'd be very keen to hear how we might be able to build the network, because obviously that's easier said than done when it comes to building a diverse global network. Maya.
Hey, just out of curiosity, is there, based on the conversation that you've already had, is there a leaning towards advocacy or clinical practice or professional support, because it's very difficult, in the current global conversation not to become overwhelmed? So in terms of the conversations you've already had, or maybe the DEA survey that you already did, the Doctors for Environment Australia survey, from that, do you already have a sense of where you might be leaning so that people can maybe think about that?
Yeah, no, thank you. And really good points. Yes. So I think it's probably fair to say, and it's probably a mixture of all three, but from our survey and our initial consultation, probably more the advocacy, the voice, and also professional support, and also influencing and helping to coordinate professional organizations with their own advocacy and education and training. But interestingly, in the prior meeting, this is session 2, we had one earlier, there was quite a voice for actually also having some practical ideas for health professionals. Put forward the argument that clinicians, whether you're clinicians or not, like to have some practical at the clinical face, I guess, actions that they can consider going forward. Those actions weren't necessarily, articulated or, decided on, but that's sort of getting down more, I guess, to specific actions that we might all be able to, I guess, support and put out, in a way, our advocacy behind. But thank you. Laura.
Hi, everyone. My name is Laura Jung. I'm a physician from Germany and chair the Environmental Working Group of the World Medical Association. So my thoughts on the questions, maybe, I think I have a couple of just thoughts that come up, and possibly you've already thought about that. So for me, kind of what's important would be to see how can we in this group not duplicate work that is done already in other spaces, because I think most of our organizations are also members of different constituency and spaces elsewhere. And then I think what would be important for this group potentially is to think really about how can we inform the other constituencies within ATACH. As I think we are the constituency that brings in most of kind of the frontline experience of how it is to work day to day within kind of with climate change consequences, I guess. and kind of goes both ways, right? And like, what can we do as health professionals, but also how can we protect healthcare workers from climate impacts? And like in this sense, inform the other constituencies that are possibly have more of like a policy making power than what we have. I think these are my thoughts on that.
No, thank you very much. They're both really, really good points. And it has come up a few times, that care, we're all very busy people. We need to be careful that we're not duplicating. But I think this is a unique voice in directly providing strategic advice to ATACH as health professionals. And as you say, to also therefore influence and provide advice and strategic advice to the other working groups within ATACH, and Elena might have something to say about that as well. So thank you.
I think it's a reflection also coming from what Laura mentioned and what has been discussed before. I see more advocacy as a means to get what we want rather than as the focus of what we are aiming to do. Because advocacy, as Laura mentioned, I mean, you have the Global Climate and Health Alliance, you have other constituencies that are already very good. And the difference with the ATACH is basically this is, oh, Laura, this, this is nice. Hola. The difference I think that the ATACH wants to bring is basically this enabler for increased action at country level. So, of course, we will need advocacy, but I wouldn't think this is the focus of the ATACH. Again, as a mean for increased action, yes. And maybe it's a little bit selfish from the ATACH Secretariat, but we really want to leverage the potential that all of the health professional associations have, of course, to influence policy, but to drive action. Because again, you are the ones that know what is happening. You know the problems that patients have. You know the reality at country level. So basically, we see a huge potential, even if every health professional association commits to try to spread the word. Maybe it's advocacy, but okay, if you implement one action within your own network, I mean, this is going to be translated in a lot of impact at country level. So this is really the idea that we have in the Secretariat, how we can leverage all this potential. Again, in many cases, maybe it's just summarizing what is happening because there are many organizations doing a lot already. So, but it's basically how we can create this network of champions that already exist for those associations to do more and to know, to learn what others are doing, what they could do in their own sphere. Again, could be national, could be regional, could be global.
Absolutely. And thanks, Elena. I think that, yeah, and it's very useful to hear your thoughts and comments on that. And I may have said it already. Can't remember if I did, but obviously things are not going to change amongst the health system unless we actually have health professionals on board and creating that change or supporting at least that change at the country level. And we shouldn't underestimate, as I think even Sarah said, the trust and the influence that we have. Yeah, Maya, thank you for putting a hand up again. And then, no, it'd be great. And then I know Maha has put something in the chat, and I was wondering if she wanted to also speak to what she's put in the chat. But please, Maya, go ahead first.
Okay, so just a quick one. I think one of the superpowers of this group will be framing, because I totally take on board what Laura is saying about not duplicating, but also using the voice of clinicians. So I think framing is probably the area that we can really find our voice. But also, I was thinking more in terms of the position statement. If we frame it in terms of global, national, sector, organization, clinical and personal, what we end up with is these are sort of, I guess, the focal points or the messages that you might consider as a clinician across those. So depending on where you're having a conversation, you can pull out the relevant framing of the problem as well as some of the solutions, because unless we sort of pitch what we need to say at the right level, it can get lost. Laura's right. There's a lot of organisations doing a lot of things. So I think our superpower in the HPA is very much what's the message at a global level? What's the message at a national level that people might want to put forward? Sector, organisational, clinical. I think the clinical practice might be where most people sort of join the conversation, and then they can find their way either up the upside down pyramid or down, and the very final one would be that personal. What can individuals do within the context so that you're effectively providing a framework to people for people to join the dots for their action so it can have greater impact.
Thanks, Maya. That's a really good way of framing it, and definitely something that we're taking notes, and we'll see if we can yes incorporate that, and to have that. I guess if you're going to have a position statement, to be able to make it needs to be a useful document as well, doesn't it? So we don't actually just want it to be making statements. It needs to be useful for health professionals to be able to take with them at whatever level, which is what you're saying basically, that they're advocating at, or to be able to use that and use it with strength and conviction. Yeah, so thank you. Clarice?
Yeah.
Right. Hello.
Hello. I'm Clarice. I'm a Brazilian nursing. Actually, I work in one governance of a Brazilian university, Rio de Janeiro Federal University. And in 2 years, we create one qualification program for health professionals and include these activities, offices, classes, workshops, and opportunities to health professionals and students, medicine, nursing, nutrition, physiotherapy, to include this subject for create one critical critical experience in this formation, these health professionals. And we agree this is very important to include in curricula. Not only this, but integrate this learning for health professional and actions in real life and secretaries and government. And when we create one opportunity to these professionals learning about it, they can advocacy and defend the ideas and get actions in real life. This is my experience in Brazil, and this course we create one opportunity to the interventional projects, these health professionals in hospital and university. And we agree that this meeting is very important to create one big movement to attend the test, the opportunity to help professionals.
Excellent. Thank you very much. And great to hear what you're doing there. And we would love to reach out actually and find out more about your program. And really, you're emphasizing the importance of education for health professionals. And obviously, that's not widespread yet as well. There's a long way to go when it comes to educating all levels of health professionals around climate change resilience and also sustainable healthcare practices. So I'd be very interested to hear more about what you're doing. And yes, thank you for bringing that up. It's the importance. Congratulations. And we do have Maya now. Hello, Maya. Did you want to speak, Maya, about what you put in the chat?
Oh, hello. You mean Maha?
Oh, sorry, Maha.
It's okay.
I dreamed
It's okay. Oh, okay. Yeah. Well, first, as I put in the chat, can you hear me?
Yes, very well. Thank
Okay.
you.
I am the executive director of the Middle East and North Africa Health Policy Forum, and that's it's an NGO. It's an independent NGO based in Egypt in the Middle East, and it works on a regional scale. And it is actually to provide evidence-based data and outcomes and bring together other NGOs and civil society organizations, policymakers, academic people, think tanks, to provide evidence-based data, to provide empirical research for decision makers. So I'm very happy to be here with you today. I attended the COP27 in Sharm el-Sheikh in Egypt, and I gave a speech there. And I attended the COP 28 the following year in Dubai. I also work on a lot of issues related to climate change with the International Organization of Migration and the UN, and also here in Egypt. And what I wanted to highlight is, of course, you all know the MENA region. It should be considered a priority for climate and health action because beyond facing some of the world's most severe climate vulnerabilities, the region is also among the most conflict affected areas in the world, of course, you know. And according to the ACLED conflict index, it is actually labeled as the most. So the intersection of conflict, displacement, water insecurity, climate issues, and stress, heat stress, it creates significant risks for the population's health and for the whole health system resilience. And this is underscoring the need for stronger regional representation and of course, target support. So this is why I put in the chat that I was just making a reminder that the region deserves dedication, attention within the climate and health agenda, given these challenges, which of course everyone knows. We don't need to elaborate on that. And so greater engagement with health professionals and other organizations from the MENA region, I think is important to developing effective context-specific climate and health solutions in one of the world's most demanding regions, if not in the 21st century. Also, I'm citing here, according to the ACLED conflict index. Thank you.
No, absolutely. And thank you very much, Maha, for highlighting the need and for the work you're doing. And I think I'll just ask if you wouldn't mind if we actually reached out to you for actual assistance in engaging more health professional organizations, associations from that region.
Excellent. That's exactly, sorry if I'm interrupting. That's exactly what I'm after. So I'll be very, very happy to help in all sorts of ways. And I'll be very happy to answer any inquiries and tell you more about my work, send them to you, provide you the link, the website, everything. Currently, I'm working with the Wellcome Trust. I'm working with NCD Alliance. So I'll be very happy to share everything.
Excellent. Thank you very much. Good. Look forward to that. And as you say, absolutely vital that there's representation from that area. And good. It's been some really great comments and advice and suggestions there, and we've still got a few more minutes. So if others that are online would, or even if you've already said something, if you've got more to add, we'd really like to just continue this discussion for another 10 minutes or so. We've got time for another 10 minutes before we should wrap up. And maybe people have other ideas about how we can build our network of HPAs across the globe. Maha has offered to help us in her region. and other regions, because we'd be very, very interested for advice and contacts and ideas. And I think, Maha, your hand is probably, you're probably finished now, and it's probably Maya, if I'm going to get my M's right here.
We're just challenging you tonight. Thank you. Just a quick one. I wonder if, in terms of the order of progression, having starting with the position statement and putting it out to all of the different associations and networks that we have, that will then prompt more organisations to come on board. So, in terms of framing it up, having a one-pager which says this is what we stand for and how we fit into the bigger picture, and then inviting networks to respond to that position paper, so it's clear, this is where we fit, this is the framing of our work, so people are really clear about what they're signing up for. That may be helpful for then the people on this call and anyone that's involved in the follow-up emails to then start thinking much more specifically and concretely. Like, I think it was great, Clarissa, that you spoke up on the university sector, for example. In my role with learning at the Geneva Sustainability Centre, we work with universities, and there are some countries that are integrating new programs around sustainability for clinicians, like embedding it in medical qualifications. And so if we have that, workforce education component in the framing, then we've got something very specific to go to them about and say, we want to be able to, for example, thinking out loud, use that element as advocacy for governments to to support universities to integrate sustainability and adaptation into their programs. I know universities are market driven, but even so, I think if they're supported at a government level to provide that, if it's subsidised or what have you, that might help expand that network and expand the work that HPA can do on a practical level.
Yeah, no, great. Thank you. Thank you, Maya. And yeah, I agree entirely. And it is a bit of a catch-22, like the chicken and the egg. But yes, the position statement, we want consultation for it, but also I agree entirely. I think we all, support that. That then once you have more of a document that can be used to promote what the actual constituency is about, that can also help bring others along on the journey. And like all documents, they can change after a year or two as well. And very, very correct also about the university and the education sector. And one of my hats is working with the Melbourne Medical School, as you might know, and others may not know, but and government support, but also I think we shouldn't forget that they're competitive organisations, and once I believe we can get the ball rolling, or there's a bit of a snowball effect that to encourage universities or other educational institutes to actually be providing this content for their students. And it's probably worth mentioning the Planetary Health Report Card, which most people on this, or many people perhaps on this meeting can know about, or you can look that up, Planetary Health Report Card, which has come out of the United States. And it has quite a few different health professional specialties now, and it actually grades each year what different universities across the globe are doing when it comes to integrating both planetary health and sustainability into their curriculum. It started off in medicine, but it now covers dentistry and audiology and podiatry from memory. I know for a fact in Australia it's influencing quite a few universities in where they're going with their education offerings. So great. We've had some really good input so far. So really appreciate that. And I'm wondering if anyone else has got a few comments or suggestions or questions, that they would also like to contribute. or also, we have had a lot of great ideas, which is really inspiring. So thank you, everyone. Being a global community, let's say that's what I'll call it, global community we're trying to build to be stronger and more diverse of health professional associations. If any of the great minds here have ideas about some of the perhaps ways of working together. So if we were having a group of health professional associations, our constituencies, ways that we might be able to work together as a constituency to share ideas, to communicate what may or may not work for us as a constituency. Let's throw that one out there if anyone's got any ideas or suggestions going forward. Very broad question, I know. One of the starts was actually the meetings today, and obviously globally. So we've got 2 different times that we're having these meetings. And perhaps that's the solution going forward, is to have meetings every so often at different times to accommodate the different time zones, and to circulate the agenda and to ask for input beforehand or consideration beforehand so that we can come along and discuss things in detail at some of these meetings. Sarah, thanks for putting a hand up.
Thanks. Just thought I would chime in on your question there around sort of building the community and diversity. One of the things that I have found more recently is we've really expanded who we're working with beyond sort of physicians and nurses, our traditional partners. And so more recently, we've been doing a lot of work with pharmacists, which has been really helpful. We work with an organization that might be present in some of your countries, called Choosing Wisely, which looks at reducing low value care, but brings a lot of different professionals into that conversation. And then as just Friday last week, I actually met with somebody from the Dietitians of Canada who is also really interested in this work. And so I think one thing that we could all probably do is think outside the box in terms of health professionals, and maybe looking at who else we can invite to the table that might not already be here.
No, absolutely. Agree entirely, Sarah. And probably we do need to not just think outside the box, but actively then invite those other groups in as well. And thanks for suggesting that. And Maya has suggested, and if people wouldn't mind, if you wanted to put your name in the chat and what country you're from, so we can actually have a quick look at the diversity in the room, which I think we've got a little bit at this meeting, so that's fabulous. Thank you, everyone. Any other thoughts or reflections before we finish up? Maya, I love the fact you've got lots of ideas.
I'm so sorry.
Great. No, please don't apologize. They're all fabulous ideas.
Just didn't want to leave you hanging, and I thought something might be useful. If we do have some universities on the call, one of the tools that we've got is a carbon emissions learning lab. It's a simulation game that allows hospital leaders to make decisions for their hospital. The goal is that they need to reduce their emissions within 7 years by 50%. And I'm just thinking if there are other tools out there that maybe we could have like a little collective repository of things. We use it specifically for leadership development, but a number of universities around the world integrate it into their medical education programs and their leadership programs, so that healthcare leaders who are making decisions about our hospitals and our healthcare system can experience the fact that they can make sustainability forward prioritization and decisions and benefit patients and benefit the budget and so on. So the point of that is, if there are tools, maybe that could be a practical element of the HPA that is targeted for healthcare professionals. And if there's anyone on the call that wants to get in touch, I'll pop my email address in as well, if that's helpful.
Oh, no,
on a
that's
practical level.
great. And thank you for bringing that up. And is that on the ATACH website as well under resources? I thought, no, it's not.
I'm
Okay.
not sure, but if you send me the link, I'll put it in there.
Okay. Well, that'd be good. And yeah, as you say, it's a fabulous tool. Good. And thanks everyone for putting your names and country where you're from in the chat. It's great to see. And we have got representatives from across the globe here. Elena, did you want to say any final remarks before we wrap up? And if not, that's fine.
Thank you very much, Eugenie. Not much to say, just to thank everybody for their inputs and contributions and thoughts and potential motivation to make sure that this constituency advances. So we count, I think, with the inputs of everybody. Thank you very much. Back to you, Eugenie.
Okay. Thank you. Can we just go to the next slide? If you can go back to the slides, Catherine. And great. So this is a QR code. If you're not already a member of ATACH, your association, or to pass this on to others to join ATACH and become then a member of the HPA constituency. As we've emphasised and said many times, we really would like input as a member organisation, but also your knowledge and experience, and to have all of you really who are on the call today help us craft what the position statement should be, could be, what it might be going forward, what the priorities and the actions are, how we can build this network to be as influential and dynamic as possible at our country level, at our clinical level, and also in helping to guide some of the work that ATACH does as well. We really are an untapped resource and a fundamental and vital part of the jigsaw when it comes to action on climate change and protecting health from climate impacts. So thank you very much. We've taken notes and we will have captured also contact details, and look forward to following up with many of you, if not all of you, that have been on this meeting, and can't thank you enough again for your time and your contributions, which have been really, really beneficial and generous.